On behalf of HCA Healthcare's Ambulatory Surgery Division, hello, and welcome to our Outpatient Total Joint Preoperative Education video series. First and foremost, I want to let you know that you're in great hands with us. We stand by our mission that above all else, we are committed to the care and improvement of human life. In recognition of that commitment, we strive to deliver high-quality, cost-effective healthcare in the communities we serve. That commitment extends, of course, to total joint replacement, and this video series details the basics of how best you can prepare for and recover from this common procedure. Elective total joint replacement is a safe and effective procedure proven to increase quality of life. Thanks to significant advancements in procedural methods and medical technology, total joint procedures can be successfully performed in an outpatient setting, such as our surgery centers. Your participation in this outpatient total joint education program is the first step in ensuring that you have the best possible experience and surgical outcomes. This is a comprehensive program designed for our total joint replacement patients, their caregivers, and their families to explain the outpatient total joint replacement process and what to expect from your surgery center experience and recovery at home. Our goal for this education class is to educate you about your surgical procedure, decrease your anxiety about pain related to surgery, help you understand your care after surgery, and discuss discharge. Teach you an exercise program to help your recovery. Prepare you and your caregiver for a safe return home. To assist you along the way, your multidisciplinary team will consist of your surgeon and their assistants, an anesthesiologist, and nurse anesthetist, a personal nurse navigator, a preoperative nurse, a specialized surgical team, and a recovery nurse. Please keep in mind that a successful total joint replacement requires that you take an active role in your preparation and recovery. It is important that you follow your surgeon's recommendations and pay close attention to the information presented throughout this educational program to ensure ideal outcomes and a speedy recovery. In addition to these video segments and your multidisciplinary team, a patient handbook and quick reference guide are provided to help you along the way. Finally, feedback is exceptionally important to us and the continued success of this program. Therefore, we welcome and encourage any comments or suggestions that you may have. Before we get into the total joint program, let's take some time to explain how a total joint replacement works. To illustrate the process, we are going to take a look at a total knee implant. The procedure begins with an incision down the front of your knee to expose the ends of the femur and the tibia to prepare the end of the femur for the implant. With the femur complete, your surgeon will prepare the tibia by removing the top section to make way for the tibial implant. The final piece needing preparation is the patella, known as the kneecap. Specialized instruments are used on the femur, tibia, and patella to ensure optimal alignment. Moving on to the implant, your surgeon will begin by placing a custom-matched implant on both the femur and the tibia. With both the femoral and tibial implants in place, your surgeon will fit the space bar on which both the femur and tibia rest. In some circumstances, an implant called a button is placed behind the patella. Upon final inspection, your surgeon will close the incision and the total knee replacement is complete. Of course, this process varies slightly between total hip, shoulder, and ankles. However, the means by which the joint is replaced is fairly universal. If you have any questions about other joint replacements, please do not hesitate to reach out to your surgeon for more information. There are a few important steps that must be completed prior to having surgery. So let's take a look at what you are expected to complete in the weeks leading up to your procedure. Let's start with one of the most important aspects of your total joint journey, selecting a caregiver. Your caregiver must be a responsible adult. They may be a family member, friend, or professional. Please keep in mind that you will be going home after your procedure and your caregiver will be supporting you throughout the process. Your caregiver may need to help you with a variety of important tasks. For example, showering, getting around to appointments, and assisting you with your prescribed medications. So, be sure to choose someone you can depend on. After discussing the total joint replacement surgery with your physician, your surgeon will review your medical history and schedule outpatient lab work for you to obtain medical clearances. Our surgery center also requires that you complete a medical health history. This can be completed by going to www.onemedicalpassport.com. In order to provide you with excellent care and minimize long phone interviews and paperwork, we ask that you complete an online medical history with One Medical Passport. The website will guide you through a series of questions on your medical history. You may also receive a phone call, email, or text from One Medical Passport directing you to complete your medical history. To start the process, visit the Surgery Center website and click Pre-Registration, and then select Pre-Register Online to go to the One Medical Passport registration page. First-time users of One Medical Passport should click the Register button and create an account. Answer the questions on each page, then click Save and Continue. Once complete, you will be prompted to click Finish to submit your information to us. The information you provide is kept on a secure site, is password protected by you, and is never shared with anyone other than your healthcare team. If assistance is needed with this step, please do not hesitate to reach out to your personal nurse navigator. While medical clearance is being processed, your surgeon's office will contact your insurance company to obtain a pre-authorization. Once your surgeon's office receives pre-authorization, they will contact the surgery center to schedule your procedure. Additionally, please make a point to contact your insurance company to determine what they cover and what your financial responsibility will be for your procedure. With your medical clearances reviewed, pre-authorization received, and procedure scheduled, the next step is for you and your caregiver to attend our total joint replacement class. Your personal nurse navigator will cover your total joint replacement journey from start to finish. Please note that attendance and completion of this class is a requirement of this facility and a critical step to ensure the best surgical outcome for you. Please be prepared to discuss all your current medications with your surgeon. This is an important step because you may need to stop taking certain medications like blood thinners prior to surgery. You will be advised by your surgeon or the pre-admission nurse what medications you can safely take the morning of your surgery. Because your diet directly affects your body's ability to recover post-surgery, maintaining a healthy diet is very important. Making sure you are consuming healthy foods such as fruits and vegetables helps ensure that you have the nutrients required for an optimal recovery. For example, by optimizing your iron levels and blood sugar before your procedure date, your incision will heal faster and minimize complications. In addition, consuming a balanced diet high in fiber will also help you manage any constipation associated with your pain medication. If you use nicotine products, it is imperative that you stop at least 4 weeks prior to surgery to reduce the risk of complications associated with nicotine, such as delayed recovery, heart attack, pneumonia, stroke, and respiratory failure. Additionally, if you are a diabetic, it is important that you are closely monitoring your blood sugar to maintain a healthy level. If your lab work returns unstable blood sugar levels, your surgery will be delayed until your levels are under control. One of the more important steps of pre-procedure preparation is learning how to use your walker. The recommended type is a 2-wheeled walker, which allows the user to practice a normal walking pattern with significantly less pain. Setting up and using your walker is simple. Adjust the walker to the appropriate height by standing adjacent to the walker with your hands at your sides. Adjust the walker handle so that it aligns with your wrist so that you have enough room to comfortably step off your surgical leg. It is important to maintain proper posture when walking. Make sure that you are not letting your walker get ahead of you. Try your best to keep even pressure on both legs at a regular pace. Once you feel comfortable with forward movement, practice turning by making several smaller steps in the target direction. As your recovery progresses and you feel more comfortable walking on your surgical leg, you may choose to advance to a cane. When using the cane, be sure to hold the cane in the opposite hand as your surgical leg. At the start of this transition, pain may increase, causing a limp. If this happens, return to your walker and use it for as long as needed. This transition may take some time, and it is important that you're monitoring your pain and comfort level. Another important mobility consideration is bathroom accessibility. In particular, an over-the-seat chair with adjustable armrests. You may want to consider this option if you're currently having issues sitting down or pushing up. An important step to check off your pre-surgery list is preparing your home for your return. Considering that you will be using a walker to get around your home, it is very important to clear your home of any hazards or obstacles to prevent falls. We recommend that you clean and declutter your home and pay close attention to electrical cords, rugs, or other obstacles. Rearrange furniture if necessary to make way for your walker. Pay close attention to railings and stairways. This will help you identify if any temporary railings should be installed. Shop in advance for plenty of liquids and meals. Change your bed with fresh linens and make sure your laundry is complete. Place night lights in your bedroom, bathroom, and main walkways. Prepare your bathroom with an over-the-seat chair if necessary. Make sure all of your must-have items, including foods and devices, are within easy reaching distance. After preparing your home, we recommend you use your walker to perform a trial run prior to surgery. Pay close attention to narrow walkways, sharp turns, stairs, and railings. This will help you identify any hazards or obstacles that should be cleared, in addition to getting a feel for home navigation during recovery. One of the most important aspects of a speedy and successful recovery after your total joint procedure is strengthening your muscles with exercise. Your surgeon will work with you and your physical therapist to create an exercise regimen that best suits your needs. Practicing these exercises preoperatively, or at least 1 week prior to surgery, will increase your comfort level during recovery by helping you establish familiarity with the movements. Your physician and physical therapist will provide you with a detailed exercise agenda for each phase of your total joint replacement journey. Now let's go over the movements of the main pre-surgery exercises you can expect to practice before your knee or hip replacement. The most basic exercise are seated press-ups, or the motion of getting up from a chair. Sit in a sturdy chair with armrests. With palms flat on the armrests, press down to lift yourself from the chair and hold this position for about 5 seconds. Then bend your elbows to slowly ease back down. Repeat 10 to 15 times or as advised. Now let's move on to leg workouts, starting with quadricep sets. Lie in bed with your legs straight. Tighten the front thigh muscle of your operative leg while pressing the back of your knee down into the bed. Hold for 3 seconds, then relax the leg. Repeat 5 to 10 times or as advised. After quadricep sets, move on to straight leg raises. Lie down on your bed, bend your good leg, keeping your other foot flat on the bed. Lift your straight leg as high as you comfortably can, but not higher than 12 inches. Hold for 3 seconds, then slowly lower your leg. Repeat 5 to 10 times or as advised. Another great exercise are heel slides. Lie down or sit with your legs stretched out in front of you. Keep the heel of your leg on the bed, then slide the heel toward you as far as you comfortably can. Hold for about 10 seconds, then slide your heel back. Repeat 5 to 10 times or as advised. The final exercise we recommend are ankle pumps, which is helpful in preventing deep vein thrombosis, a condition stemming from poor circulation. Luckily, this exercise is very simple. Simply pump your ankles up and down like you're stepping on a gas pedal. Please keep in mind that these exercises may be difficult to perform after surgery. If these exercises are too difficult to perform postoperatively, your caregiver may help you achieve the full range of motion and extension. Let's go over the general timeline of the weeks leading up to your total joint replacement procedure. 2 weeks prior to your date of surgery, the Surgery Center Business Office will contact you to discuss any insurance payments that must be made prior to surgery. Immediately after this call, or in the days following, the pre-admission team will reach out to you about scheduling your total joint education class at the surgery center. After completion of the preoperative total joint education class, please remember to prepare your home for your arrival and practice walking with your walker and performing those exercises we reviewed earlier. In addition to preparing your home, it is crucial to prepare your body. Staying well hydrated is essential to a speedy recovery, so remember to drink plenty of fluids in the days leading up to your surgery. Regarding food, please consume a well-balanced and healthy diet consisting of vegetables, fruits, lean proteins, and whole grains. The evening prior to your surgical date, you must wash your body with the CHG shower gel. CHG gel, or chlorhexidine gluconate, is a special antiseptic soap that prevents infections. You will also repeat this wash the morning before you arrive at the surgery center for your procedure. Let's go over the steps for using the CHG gel. Before applying the CHG gel, wash your entire body with whichever regular soap you use. To apply the CHG shower gel, apply a generous amount to a sponge and work into a rich lather. Firmly massage the soap onto your skin in all 6 areas as shown, from top to bottom. Avoid your eyes and ears. Clean all indicated areas and pay particular attention to your surgical site. Leave the soapy lather on your body for 2 minutes. After thoroughly rinsing the CHG soap, dry off with a freshly laundered towel and put on freshly laundered clothes. It is also important to sleep in freshly laundered sheets to keep your skin clear of any bacteria. Remember to repeat these steps in the morning before you arrive at the surgery center. Tip: it's a good idea to refrain from shaving your legs prior to surgery, as this can introduce infections. After you've washed with the CHG gel for the second time the morning of your procedure, it is time to get ready to head to the surgery center. Remember to wear freshly laundered, comfortable, loose-fitting clothes. Remember, do not bring any valuables to the surgery center. If you have any questions on what you should and should not bring to the center, feel free to reach out to your personal nurse navigator at any time. When you arrive at the surgery center, you will check in with the receptionist at the front desk. If you have any outstanding financial obligations, the receptionist will ask that you complete it prior to having surgery. To avoid any issues with payment, please be sure that you understand your insurance policy and are prepared to meet any outstanding payments prior to surgery. When the preoperative nursing team is ready for you, a staff member will escort you to a room to prepare you for surgery. Our nursing staff will verify your personal information and the procedure you are scheduled to have. Once you have changed into your gown, the nursing staff will begin preparing you for surgery by taking vitals and starting antibiotic IV fluids to assist in the prevention of infection. Your surgeon will visit you to answer any questions and mark your surgical site. Your anesthesiologist will also visit you prior to surgery to inform you on how you will be kept comfortable during your procedure. To ensure accuracy and your safety, your surgical nurse will confirm the surgical site just prior to heading to the operating room. Remember, if you have any questions before heading to the operating room, please feel free to ask. Your surgery will take approximately 2 hours, but keep in mind that surgical times vary by patient and surgeon. Your surgeon will inform your caregiver or family how long they expect your surgery to last, and your nursing team will make every effort to keep you and your caregiver informed if anything unforeseen should happen while you are waiting. Immediately after surgery, you will be transferred to the post-anesthesia care unit, otherwise known as the PACU. Your time spent in the PACU varies based on multiple factors such as body temperature, blood pressure, and comfort level. While in PACU, you can expect recovery nurses to perform multiple tasks such as administering medication and checking your vital signs. Your mobility training starts as soon as you enter the PACU, so be prepared to perform some physical tasks such as ankle pumps and breathing exercises. Let's talk about pain management. It is our aim to make sure you are as comfortable as possible after surgery. Pain management is not perfect, and you will have some discomfort after your surgery, most of which occurs within the first 24 to 48 hours. However, you will receive oral pain medication to take as directed to manage pain. Your pain will steadily decrease as you progress with your physical therapy exercises and walking. There are several factors that limit our ability to completely eliminate pain after surgery. The first is that pain medications have side effects, which may include decreased ability to breathe normally, low blood pressure, nausea, and constipation. Other less common side effects may include itching, urinary retention, and abdominal distension. The amount of medication given may have to be reduced at times to avoid creating dangerous or uncomfortable conditions resulting from these side effects. Another factor is tolerance. The body tends to become less responsive to pain-reducing actions of narcotics after being exposed to them for periods of time. Patients who have taken large doses of narcotics for months or years may have a much harder time keeping comfortable after surgery. It is very important to provide accurate information to your surgeon about the amount of pain medication you have been taking. Inaccurate information could result in a needlessly painful and stressful postoperative class. Note that it may be necessary to taper or discontinue your use of narcotics prior to surgery. Once you've had your surgery, we will rely heavily on your own assessment of your pain and work with you to relieve it. One method of relaying your pain to your nursing team is by using the Wong-Baker FACES pain rating scale, which is categorized 0 to 10, 0 being no pain and 10 being the worst pain. Immediately after surgery, the goal of your nursing team is to achieve a tolerable pain level. Do not wait until your pain is severe before you ask for pain medication. When you arrive home, taking your pain medication as prescribed will allow you to meet your physical therapy goals while maintaining a balance of pain relief. Try to request your pain medication about 30 to 45 minutes prior to your therapy sessions. Again, it's important to note that you will be going home after your surgery. When you reach a manageable comfort level, your nursing team and physical therapists will begin the discharge process with the walking portion of mobility training. Your nursing team will start by assisting you with your walker until you are capable of getting out of bed and walking approximately 100 feet on your own. Next, you will be asked to navigate the restroom and void your bladder. The nursing team will also review surgical dressing and site care instructions, showering instructions, review home navigation techniques, and provide you and your caregiver with information on medications. Finally, your nursing team will ensure that you have a follow-up appointment scheduled with your surgeon and that all necessary home medical equipment has been ordered or received. Once your nursing team determines that you are able to ambulate safely with your walker and all other discharge requirements have been met, you will be discharged home. Your nurse navigator will inform your caregiver of the correct discharge location. Please keep in mind that while there is no specific vehicle type requirement, taller vehicles such as trucks and SUVs and low sports cars will be more difficult to get in and out of. As with any surgery, there are some risks associated with the total joint procedure. Although we monitor for all possible risks such as blood loss, stiffness, and persistent pain, the main risk we monitor for is deep vein thrombosis, or DVT, and pulmonary embolism, or PE. Although there is a very low risk for these complications, if it does begin to form, it happens soon after surgery. Therefore, we constantly monitor for any indications of DVT after surgery. DVT is a condition where a blood clot forms deep in the body, such as your leg. If you are immobile for an extended period of time, your circulation slows down and can cause slow-moving blood to pool together and form a thrombus or clot. The thrombus may detach in the deep vein, travel through your body, and ultimately lodge itself in the pulmonary artery and can potentially block blood flow to the lungs. This is called a pulmonary embolism and is a very serious condition that can damage your lungs or, in very serious cases, cause death. Symptoms include shortness of breath, chest pains, irregular heartbeat, or coughing that produces blood. The most common symptom is swelling in the leg, a change in color, a warm sensation in the leg, or slight pain in the calf. If you notice any of these symptoms, contact your surgeon as soon as possible. We prevent deep vein thrombosis by using sequential compression devices during and after surgery, which are sleeves that go on your legs and gently compress your legs to encourage circulation, and administering anti-clotting medication. However, the most effective way to prevent DVT is by getting you moving immediately after surgery with exercises such as ankle pumps. Your surgeon may prescribe blood thinners such as aspirin or a take-home sequential compression device. After you leave the surgery center, we recommend that you do not sit down for long periods of time. We want you to maintain an active recovery. Another important condition to keep an eye out is for a surgical site infection. This is a rare side effect given the preparation with the CHG shower gel and the antibiotic IV, but if it does happen, it will not be noticeable until well after your surgery. In your follow-up appointment with your physician in the weeks after your procedure, your surgeon will check to see if an infection is starting. It is normal to have some pinkness, so what your surgeon is looking for is redness, drainage, and signs of a fever. If at any point you're noticing pinkness turn red or a growing area of redness, please contact your surgeon immediately. We must stress again that you will be going home the day of your surgery. There are some things you need to know for your safety, comfort, and a steady recovery. Each person will heal at a different speed, and your surgeon will advise you on when you can begin increasing your activity. While you're at home, there are a few best practices you should keep in mind. First, remember that walking is your best exercise. When walking, always remember to use your walker until your therapist or surgeon has removed the device. Do your best to bend your knees as you walk and use the heel-toe gait. It is a good idea to walk as often as possible each day, but do not stress yourself. Instead, you should gradually increase the distance or time you spend walking as your comfort level increases. When navigating stairs, remember, up with the non-surgical leg and down with the surgical leg. Next, let's cover sitting. Always remember to sit in a straight back chair with arms to make standing easier. Despite being comfortable, avoid sitting in recliners, sofas, or other chairs that might be difficult to get out of. When you're ready to sit, use your walker to back up to the chair until you feel it against the back of your non-surgical leg. Move your surgical leg forward and reach for the arms of the chair. Lower yourself slowly, being sure to keep your surgical leg extended out in front of you. It is okay to prop the surgical leg on a stool or chair that is level with the chair you are sitting in. If you had a total knee replacement, remember to keep your knee perfectly straight. This is critical to the success of your recovery. When resting, which you should do at least 1 hour in the morning and again in the afternoon, be sure to elevate your leg, but pay special attention that the pillow is placed under your ankle, not your knee. If you're feeling some discomfort, you may use ice for pain control, but do not exceed application for more than 20 minutes each hour and use a barrier between your incision and the ice. Heat may also be applied, but only in areas with muscle spasms and never directly on your surgical site. Again, we want to emphasize that you should take pain medication as directed. You should always consult your surgeon on the use of non-steroidal anti-inflammatory drugs such as ibuprofen, Motrin, Advil, and Aleve. If you experience any of the following during your recovery, please call your surgeon. A fever over 101.5 degrees. A new substantial increase in pain. New numbness or tingling in your legs. Increased redness or swelling around the surgical site. Persistent or increased drainage from the incision, or no bowel movement for 4 days with no results with laxative use. Maintaining a healthy diet is just as important during recovery as it is prior to surgery. If you have poor appetite, which is normal, and you do not feel like eating much, be sure that you still make healthy food choices. You may also want to try eating 5 to 6 smaller meals or adding nutritious snacks to your diet. We recommend food high in fiber and plenty of water to stay hydrated. As mentioned before, you may experience problems with constipation after your surgery, which is a common side effect of narcotic pain medications. Your surgeon may prescribe a stool softener or laxative for you to alleviate any discomfort from this condition. As your activity increases and your diet progresses, your regularity will return back to normal. Gauging when you return to work or activities varies from patient to patient since all of our bodies heal differently. A significant portion of your return to normal is dependent on you being a motivated patient and closely following the advice of your surgeon and physical therapists. As you progress with walking, it is important that you set reasonable expectations for your recovery. For example, expecting to play tennis 2 weeks after surgery is not a reasonable expectation. Instead, commit to making incremental advancements over time so that your muscles have time to fully recover. By following an incremental approach, you can avoid injury and be well on your way to a speedy recovery. When it comes to returning to work, driving, and other related activities, please consult with your surgeon and physical therapist for guidance. Throughout this video series, we have covered a lot of information about your total joint procedure. There's a lot of information to digest, and I know it can feel a bit overwhelming, but just remember that we are here for you every step of the way, and we encourage you to contact your surgery center if you have any questions about your total joint procedure. We hope that this video series has provided you with a better understanding of the total joint replacement process. We look forward to serving you and wish you a great recovery.